My name's Gary McCarron. I'm with the Group Division out of San Antonio, Texas. I'm here to give you a little short seminar on Medicare Part B, on what the benefits are for 2013. What we're going to do is explain what Part B is, what it covers, and the options that you have, and how to fill the gaps with the different plans that are available. So how do you qualify for Medicare? Well, you're eligible for Medicare when you reach age 65. You have an open enrollment period that's 3 months before, during, and 3 months after you do turn age 65. Now, on your medi-gap policy, this is your guaranteed issue period. If you apply for a medi-gap policy, there is no underwriting. It's just guaranteed that you're going to get that policy that you apply for. You can also become eligible if you become disabled, and you've been disabled after 2 years. And if you have end-stage renal disease, that qualifies you for Medicare too, if you're before age 65. All right, the Medicare plan parts, you have Part A. We've done a seminar on that. We're doing a seminar on Part B, which is the physician charge. There is Part C, which is Medicare Advantage plans, they call them. You have Part D, which is a prescription drug card, and we'll explain those in other seminars. Now, the Part B medical coverage is, you qualify for it if you qualify for Part A. And Part B is never paid up, and it's usually deductible from your Social Security check. Your monthly cost for 2013 is $104.90. If you retire before you turn age 66 and you don't receive your Social Security until age 66, you're going to have to pay for this out of your pocket. $104.90 is going to be your cost. If you make $85,000 or less a year, now if you make more than that, here's the chart and there's a grid. If you make $214,000 and above a year, your costs are going to be $335.70. This is what they call means testing. Part B continued. Again, the open enrollment period is 3 months before, during, and 3 months after you turn age 65. General enrollment period is if you miss the open enrollment period. And if you miss the open enrollment period, you're going to have an area of coverage that you may not want, and you don't want to have any bills in that area unless you're covered by another major medical plan. Now, if you do miss the open enrollment period, you're going to get fined 10% for every year that you're out of compliance, and then the open enrollment period is January to March 31st. That's the only time that you can enter into the Medicare Supplement Part B if you miss the open enrollment. Now, the effective date is going to be July the 1st in special enrollment period. If you have a group health plan, that's opened up too. So you have several different times of special enrollment. You got January through March. If you've been under a group health plan, you lose that. That gives you a special enrollment period too. You don't have to pay the 10% penalty in that scenario. Part B, the gaps, we're going to take a look at that. Part B helps you pay for the doctor fees, outpatient hospital visits, other medical services and supplies that aren't covered under A. This is the key, that aren't covered under A. The deductible part of Part B, the annual deductible for 2013 is $146.90. That does change periodically. The cost sharing Part B, you're required to pay 20% of the total cost after you've satisfied your deductible. Let's take an example of a claim. Assume you have open heart surgery, Medicare Part A, hospital. You get an EOB from the hospital because you only stayed for 7 days. Part B, you get a surgeon's fees for $25,000. So let's look what we're going to have to pay under Part B. You're responsible for the deductible, which is $146.90 for 2013, plus the 20%. As I was telling you, this is where you get bit. You're going to pay $4,970 at the 20% rate after the deductible's been satisfied. So you're looking at a total of $5,117.52. That's just for Part B. So let's take a look and see how the gaps look at the red area here. So let's say we look at that little claim right there that you had. You can see you have your deductible. This 20% goes out to infinity. You never get that paid. Now, if you go to a doctor, sometimes they can charge you 15% above what the medically approved amounts are by Medicare. Now, you do get one one-time annual WellCare visit with Medicare annually. Some more Part B area gaps. Medicare will pay 100% of all approved services medically necessary for skilled health services and medical supplies. And you fall into some of the area with durable medical where you do have your Part B deductible that kicks in, and it's the old 80-20 rule. At home recovery services, you pay 100% of all approved services. Foreign travel, it's not covered except in an emergency. So let's take a look at the medi-gap policies. Now, in 1990, CMS standardized all of the medi-gap policies, and they said, all right, you got to offer to the insurance companies A, B, C, D, E, F, G. They had several different options. Some of them are no longer available. They do change every now and then. The most popular are F and G. That's what I recommend to most of my clients. These give you the best coverage for the least amount of money. So let's look at what these gaps fill. Okay, you remember the not filled before, and these are the gaps that are filled by the medi-gap policy. Option F pays your deductible. The only difference between F and G is G doesn't pay your deductible, but F does. Now, F and G both pay after the deductible $146.90. They pay the 20%, and if you go to a doctor where he does charge you excess, they will pay for that. Both plans will. Medicare pays 100% of these approved amounts. Now, what your option F and G both will pick up is this part of it. Now, G is going to only pick up 20%. F is going to pick up the deductible. At-home health care, you're only here too. Now, if you do have some foreign travel, you do have a limited benefit after deductible if you do some foreign travel. Some of the items and services that Medicare doesn't cover: long-term care, also called custodial care, routine dental or eye care, dentures, cosmetic surgery, acupuncture, hearing aids, and exams. These are not covered under Medicare and the medi-gap policies. This is the end of the seminar on Part B. I hope this helps you understand how your Part B works.